Daratumumab is a monoclonal antibody targeting CD38, which is an antigen expressed on the surface of malignant plasma cells in the AL amyloid, thus providing the rationale for its use in this setting. So we looked at patients treated with daratumumab monotherapy between 2016 and 2019, who were seen at the UK National Amyloidosis Centre, and identified 53 patients. We found that amongst these 53 patients, patients had a median of 3 prior lines of therapy, which reflects the fact that in the UK, daratumumab is only licensed in multiple myeloma as a 4th-line option. We found that within our cohort, 13 patients, so about a quarter, had had an autologous stem cell transplant in the past as well. So within this group, we found that at 3 months, 38% of our patients were in a complete hematological response, and a further 28% had achieved a very good partial response. We found that as patients had a very rapid response. The median time to response was just 1 month, and we actually weren't able to assess hematological response prior to 1 month, as we hadn't performed light chain assessment at that stage. So actually, the response could have occurred even earlier. We also found that of assessable patients, the cardiac responses were seen in almost 50%, with renal responses in a quarter of patients. We didn't see any liver responses, but the patient numbers were small. In this study, patients were followed up for a median of 9 months after starting daratumumab, and we had a median progression-free survival of 20 months and a median overall survival that was not reached. Patients who achieved a complete hematological response lived significantly longer, as did those who achieved a rapid response. We also found, as sort of found by many other studies, that daratumumab is particularly well tolerated, with the commonest reactions we saw, although these were only grade 1 or 2, were infusion reactions in 13% and thrombocytopenia and fatigue in 11% of patients. So in summary, we find that daratumumab monotherapy is an effective agent in patients with multiply relapsed systemic AL amyloidosis and should be considered if it's an available option and patients have not received daratumumab in the past, either alone or as part of a combination earlier. We also found that responses are rapid, and our overall response rate was 84%. A complete hematological response also predicted overall survival.